Welcome to a brand new deep dive, everyone. So today, we're venturing into a highly sensitive, intimate, and honestly just rapidly growing area of aesthetic medicine.
Yeah, it really is exploding right now.
It is. We're talking about female genital cosmetic procedures. And specifically, our mission today for you, the listener, is to answer a very precise question from the stack of medical literature we have here.
Right, which is looking at whether collagen stimulators, things like poly-L-lactic acid or calcium hydroxyapatite can ever be safely used in the labia majora instead of traditional hyaluronic acid.
Exactly. So if you want to know the cutting-edge science behind non-surgical intimate aesthetics, you are in the right place. Our sources today range from strict advisory opinions from the American College of Obstetricians and Gynecologists.
Right.
Yeah, ACOG, all the way to brand new clinical trial data, retrospective studies on Sculptra and Radiesse, and even these emerging hybrid protocols.
It's a lot of ground to cover.
It is. So whether you're a medical professional trying to catch up on the literature or you're just insanely curious about how aesthetic medicine is evolving, you're in for an eye-opening conversation about tissue regeneration today.
Absolutely. Because the demand is just, well, it's skyrocketing.
Oh, the numbers are wild. Just looking at the stats here, labiaplasty rates in the U.S. jumped more than 50% between 2014 and 2018.
Which is a massive surge for any surgery. And our sources attribute this to a few modern factors,
Yeah.
There's a marked increase in pubic hair removal, waxing, shaving, lasers.
Right.
And when you remove that hair, you naturally just draw more attention to the external genitalia. It highlights asymmetries that, have literally always been there.
And we should be super clear, those asymmetries are completely normal human anatomy.
Oh, absolutely normal.
Yeah.
I mean, nobody is perfectly symmetrical. But you combine that newly visible anatomy with the internet and all the imagery out there.
Yeah.
And then you factor in the very real desire to reverse age-related or menopause-related volume loss. And suddenly you have this massive demographic actively seeking surgical alteration.
Which brings us to the real tension in our source material, because the medical establishment looked at that 50% surge in surgery and basically tried to pull the emergency brake.
They really did.
Yeah, I have ACOG committee opinion number 795 right here, and they do not mince words.
No, they offer a very sobering reality check. ACOG clearly states that elective female genital cosmetic surgery is not medically indicated.
Right.
They point out that it lacks high-quality efficacy data. And it lists some pretty severe potential complications, like severe pain, scarring, altered sensation.
The risk of chronic pain is a big one they mention. And it's not just ACOG, right? The FDA actually issued warnings against using energy-based devices for this.
Yeah, things like lasers or radio frequency for what the industry calls, quote, vaginal rejuvenation.
Right, because of the burn risks. But wait, if ACOG and the FDA are both waving these massive red flags about surgery and lasers, isn't that exactly why patients and doctors are pivoting to injectable fillers?
That is exactly the point.
It feels like the industry is just trying to find a safer middle ground,
Right.
between doing absolutely nothing and actually going under the knife.
I mean, that exact tension is what drove the medical aesthetic community to explore dermal fillers for the labia majora in the first place. They wanted minimally invasive volume restoration.
Without the downtime.
Right, without the downtime and scarring of a surgical labiaplasty, and also trying to avoid the unpredictable nature of autologous fat grafting.
Where they take fat from your thigh or something and move it.
Exactly, because sometimes the body just reabsorbs that fat, and it's uneven. So they landed on hyaluronic acid, or HA, as the easiest standard tool.
Right, the gold standard. So before we get into if PLLA or CaHA can replace it, let's briefly look at why HA is the baseline. So HA fillers like Deserial Plus is mentioned in the stack. They're water-based. They offer this really immediate plumping effect.
And the safety profile is very well documented. The East Lane study protocol in our sources highlights this. They inject it using an 18-gauge blunt cannula.
So not a sharp needle.
Right, a blunt cannula, and they do it in a slow, linear retrograde pass. So you're laying down a smooth track of filler safely, pushing blood vessels aside instead of piercing them.
And the biggest safety net with HA is that it's reversible.
Right, 100%. That is its main advantage. If there's an issue, you can dissolve it with an enzyme called hyaluronidase. And generally, the HA lasts about 9 to 12 months.
Okay, so if HA is so great and reversible, here's the breaking point. This is why we need alternatives. What happens when a patient comes in with severe atrophy, like excessive flaccidity?
This is where HA fails.
Right. So for you listening, imagine a highly stretched out, thin rubber balloon. The rubber has lost all its elasticity. If you just pump heavy water, which is basically what HA is, into it, it doesn't magically become a firm balloon again.
No, it doesn't.
It just sags heavily under the weight.
And the clinical reality of that is actually pretty startling. In the medical sources, they use a highly specific term for this aesthetic failure. If you inject high molecular weight HA into excessively flaccid labia, it can lead to the formation of vulvar testicles.
Oh, wow. I mean, that is a striking image.
It really is.
Yeah.
But it describes exactly what happens. The skin simply cannot support the volume, so it results in an unnatural hanging appearance.
Gravity just takes over.
Exactly. And this specific aesthetic failure is exactly what opened the door for collagen stimulators.
Okay, so let's answer the core question of the mission. Can calcium hydroxyapatite, CaHA, and poly-L-lactic acid, PLLA, be used safely here?
Yes, they absolutely can. But they require a complete paradigm shift.
Because they aren't just fillers.
Right, they're biostimulators, so they serve a fundamentally different purpose. Instead of just filling a space, they trigger a controlled, subclinical inflammatory response.
Subclinical meaning it's microscopic, you're not getting a fever or huge swelling.
Exactly. It's on a cellular level. This inflammation induces neocollagenesis.
Making new collagen.
Specifically type 1 and type 3 collagen. You are tricking the body into growing its own new structural tissue.
Let's deep dive into CaHAs first, because the sources show CaHA can be used for labia majora that need like some initial volume but are too flaccid for regular HA.
Yeah, but there is a massive safety rule with CaHA. You cannot just inject it straight. It must be hyperdiluted.
Like incredibly diluted. The sources say a 400% dilution.
Yes, 400%. They mix it using carboxymethylcellulose gel, CMC gel, and saline, and they inject about 3.0 L-liters per side.
It's basically a wash at that point.
It is, which is what makes it safe for that delicate tissue. It spreads evenly and stimulates the collagen without creating heavy lumps.
Okay, so that's the LAH. What about PLLA? Poly-L-lactic acid, which people might know as Sculptra.
So PLLA is used for cases of excessive flaccidity, not just the labia majora, but across the mons pubis as well.
The area right above it.
Right. And our sources cite a retrospective study that is pretty incredible. 100% of the subjects showed improvement in flaccidity and overall appearance.
Wait, 100%?
Yes, every single subject in that cohort. But the technique requires patience. It's usually 3 sessions, spaced 30 days apart.
Because the body actually has to have time to build the collagen.
Exactly. But the payoff is the longevity. While HA lasts maybe 9 to 12 months, the effects of PLLA can last up to 2 years.
Because it's your own tissue now.
Yes, it's native collagen.
But I have to push back on the safety aspect here. On behalf of the listener, we said HA is instantly reversible. If you don't like it, you dissolve it. CaHA and PLLA aren't instantly reversible.
No, they are not.
So what happens if something goes wrong? Isn't the risk of getting nodules or lumps terrifying in such a sensitive area?
It is a very real risk. And that is why the clinical literature outlines these non-negotiable safety protocols. You have to follow them to avoid those exact adverse events.
Okay, let's go through the rules. Rule number 1 from the sources.
Never inject into the mucosa area. The inner hairless tissue. The injections must stay strictly in the superficial subcutaneous tissue of the outer labia majora.
Rule number 2.
You must use a blunt cannula, usually a 22-gauge, 5-centimeter cannula, and employ a continuous fan technique.
So you're constantly moving it, fanning it out, so the product doesn't just pool in one spot and compress a blood vessel.
Precisely. Keep it moving.
And rule number 3, which is fascinating, is the massage rule.
Yes, especially for PLLA, the area must be vigorously massaged by the doctor post-injection. But then the patient has homework.
Right, they have to do it at home. The 5-5-5 rule.
Yes, they have to massage the area firmly for 5 minutes, 5 times a day, for 5 days.
Which sounds intense, but if you think about it, it makes total sense. Like, imagine you're planting grass seed. If you just dump a pile of seeds in one spot, you get this thick, clumpy tuft of grass.
Right.
The massage is basically raking the seeds evenly across the soil, so you get a smooth lawn. You're spreading out the PLLA particles so the new collagen grows evenly, right?
That's a perfect analogy. You prevent the body from building a massive clump of collagen in one spot, which would feel like a nodule.
Wow. Okay, so we've got HA for volume, PLLA, and CaHA for fixing flaccidity. But looking at the newer data, it seems like doctors aren't even making you choose between them anymore.
No, the clinical approach is really matured. They are doing what's called canvas prep.
Which means combining their strengths. So how does a sequential treatment work?
For severe cases, doctors will now use PLLA, KHA, or even PDO threads first.
The threads that dissolve and build collagen?
Exactly. They use these biostimulators to replace the dermal collagen and physically tighten the canvas of the skin. They shrink the balloon first, basically.
Okay.
And then 60 days later, once the skin is actually firmed up, they bring the patient back and inject HA for the actual volume.
That is so smart. But the sources also talk about single treatment hybrids where they don't even wait the 60 days.
Right. They're literally blending KA and its CMC gel with HA in the same syringe.
Injected subdermally.
Yes. And this gives patients the immediate volumization from the HA, plus the long-term regenerative benefits of the CaHA in one go.
Which the sources say is showing great success for post-labiaplasty patients, women who had the surgery to reduce the inner tissue, but are left with laxity on the outer skin.
It improves the skin quality uniformly without them having to undergo another surgical procedure like fat grafting.
Which really proves a point for you listening. Aesthetic medicine isn't just about, like, pumping up tissue with heavy filler anymore.
No, it's moving toward true tissue regeneration. It's this delicate science of matching the specific structural deficit. Is it volume loss or is it skin laxity with the exact correct molecule?
So just to summarize everything before we get to our final thought, the answer to our deep dive mission is yes. PLLA and KHA can be safely used in the labia majora.
Specifically when skin flaccidity prevents the use of traditional HA.
Right, but provided, and this is a massive one, provided that strict protocols regarding dilution, tissue depth, and that post-care massage are followed.
Absolutely. The safety protocols are non-negotiable.
Okay, so that covers the cosmetic side, but I want to leave the listener with this really provocative final thought from the stack. It's a clinical trial from clinicaltrials.gov-SR that completely flips this on its head.
Oh, this is fascinating. This is the new frontier.
Yeah. So we've spent this entire time talking about cosmetics, right? Aesthetics, vanity. But researchers are now testing poly-L-lactic acid injections as a frontline treatment for pelvic organ prolapse.
Specifically stage 2 cystocele.
Right, which is when the pelvic floor weakens and the bladder drops into the vagina. It is a huge medical issue.
And normally you either manage that with a physical device or you undergo invasive reconstructive surgery.
But this trial is testing if this cosmetic biostimulator, the exact same Sculptra used for wrinkles and flaccid labia, can regenerate the vaginal tissue strength enough to cure a medical prolapse without surgery.
It is wild to think about. They're relying on that exact same neocollagenesis to build actual load-bearing structural support inside the body.
So I want you to ponder this on your own after we sign off. What happens when the tools of cosmetic vanity become the future of functional regenerative medicine?
It really blurs the line, doesn't it?
It does. Could a cosmetic filler eventually replace reconstructive pelvic surgery? It's just incredible to think about where the science is headed.
Truly game-changing.
Well, thank you for joining us on this deep dive. Keep exploring, keep questioning the evolving science of human health, and we will catch you next time.